I'm very pleased to see how the clinic has evolved and the number of patients that are being served today and will continue to be served at the clinic. The need is certainly there. And to hear the testimonials of patients who have been served by the clinic and what it has meant to them to have a space to go as opposed to the emergency room. They have a doctor's office. The clinic is their place to have care provided.
Illinois Wesleyan's partnership with the Community Healthcare Clinic enhances our curricular offerings. We have many students who provide translation for Hispanic clients, and the experience they have with the nurses at the clinic has really propelled them into a professional nursing role.
I started volunteering at the clinic in summer times, and so actually a student told me about it and said, you know, there's a growing need over there, and I thought, oh, let me go check this out. I was there for a couple summers, great dynamic at the clinic, and I thought, wow, this is a nice opportunity for a possible class. And at the same time, the School of Nursing at Illinois Wesleyan was looking to develop Spanish-speaking opportunities for their students. So we created this course, Medical Spanish and Cultural Competency for Healthcare, and that started, I think, in 2003. I've been teaching this class, like I said, for over 10 years, and every year the students say the same things, how welcoming the people who work at the clinic are, how much they do for the community, and what a wonderful opportunity it is for the students, and then, of course, the service provided to our community.
I saw the clinic grow from a handful of patients to hundreds and hundreds of patients. Saw the staff grow, saw basically very few policies in place to a whole bunch of policies, good policies that would make the clinic a healthier place and a more productive place as well. They asked me if I'd be willing to join the board, and they asked and I said yes. Love the mission. There are just so many broken people in our community, and just the desire to be able to help them with their physical needs. I'm kind of on the side of helping people with their spiritual needs, and the clinic just fit right into that. Saw fundraising grow significantly. Saw an enormous amount of grants come through.
It was 2002 when I knew that I wanted to get involved in my community a little bit more. I just happened to see in our church bulletin that there was a need for volunteers at the Community Healthcare Clinic. I truly love the dedication and perseverance and kind and generous nature of all of the staff. They are just such a wonderful group of individuals that really band together to do the best for our patients. It's working with the patients, which I really enjoy.
We had a number of volunteers that came in quietly, unassuming, took a role in, especially I remember working with our meds for the pharmacy and sorting those and getting those organized. Frankly, this is not a very deep funded program. We really depend on the community in many ways to make contributions to keep the clinic going. And if it were not for the volunteers, if we had to hire all the people that did the tasks that they do, it would be a much more costly operation. You know, the clinic, and the whole community for that matter, is blessed with wonderful volunteers. I guess I'd like to use this opportunity to say thanks to all the people that do that.
The framework that was established by our early leaders has allowed healthy growth and expansion since those first evening clinics. From serving 700 patients that first year to becoming a medical home to almost 2,800 current clinic patients, we remain committed to ensuring everyone in our community has access to quality health care. And for that, we are forever thankful. To every steering committee member, every board member, every volunteer, every community partner, every staff member, and every donor who has invested in the clinic, we thank you. Thank you for making McLean County a healthier community for us all.